Hi, I'm Leah Sieber, and I'm going to talk to you about Croydon C-Card condom distribution scheme. Croydon had a condom distribution scheme in place since the 1990s, but it was recently relaunched as a C-Card scheme in September 2009. So, what is a C-Card scheme? A C-Card scheme is a condom distribution scheme for young people under 25, offering easy access to free condoms in a wide range of places which are acceptable to them. An acceptable place is obviously dependent on the person, so by distributing condoms in a number of different settings, we provide young people with a choice and work towards reaching as many under 25s as possible. Current distribution sites are youth centres, charity organisations, pharmacies and GP practices. So, why youth centres provide the young person with a familiar, comfortable environment, pharmacies equally are a traditional setting which young people would associate with obtaining condoms. Nevertheless, a lot of young people perceive condoms as expensive, so there is a big advantage to offering free condoms in the same environment. So, why condoms at all? Well, as stated in the World Health Report in 2001, condoms are the only contraceptive method proven to reduce the risk of all sexually transmitted infections, including HIV. They can be used as a dual-purpose method, both for prevention of pregnancy and protection against sexually transmitted infections. And how does this fit in at a local level in Croydon? Here you can see a chart mapping the 2008 teenage pregnancy rates for London boroughs. And as you can see, Croydon has the 5th highest rate in London, which you can see here labelled with the red arrows. This is roughly 56 pregnancies per 1,000 young women aged 15 to 17. Additionally, the statistics showing sexually transmitted infection rates in Croydon from 2007 to 2009 highlight that chlamydia is still by far the most common. And although there was a small drop in 2009, probably due to the rise in screening as part of the National Chlamydia Screening Programme, which you will learn about in other elements of this training, there were still almost 1,200 cases diagnosed. So, this is what the Croydon C-Card scheme looks like. We provide posters with a space underneath in which to write information bespoke to your service, and the C-Cards young people use to obtain condoms come in either the purple and green or purple and orange designs. So why the C-Card? Well, membership encourages a coordinated, consistent condom distribution network, meaning it helps us work together to provide a consistent, recognisable message which is borough-wide. Monitoring for us is made easier, so we know who is accessing the service and we can identify areas of need. The recognisable branding helps to raise awareness, and young people identify with the scheme. And C-Card condom distribution schemes are currently a pan-London initiative, with the idea of ultimately providing young people with an ability to access free condoms London-wide and then hopefully nationwide. So, this is how the scheme works. There are 2 types of C-Card available. There's a 16 to 24 age card, and with this card, young people can use the C-Card to obtain condoms at any distribution site a maximum of 8 times. These cards, the 16 to 24 card, are also available for vulnerable adults over 25. So this will cover vulnerable adults who are maybe injecting drug users or adults living with HIV. The 13 to 15 year card allows young people to use their C-Card to obtain condoms at any distribution site a maximum of 4 times and is the purple and green colouring. Pharmacies act as distribution-only sites. New service users can register for the C-Card scheme at a variety of local registration sites to which they should be signposted by the pharmacy. During the registration process, a practitioner will take them through Fraser guidelines if they apply for under 16s and give them an opportunity to just talk about their sexual health and any issues they might have. Once in possession of a C-Card, young people can then access any C-Card distribution site for condoms. Condoms should be issued in a one-to-one situation, where possible, or over reception, ensuring discretion is observed to maintain user confidentiality. And they should only be issued on presentation of a valid C-Card. The young person is always issued with 10 condoms and 2 sachets of lube, and the 16 to 24 card allows them to collect condoms 8 times before the card runs out, and they are required to have an update chat at a registration site when they will be issued with a new card. 13 to 15-year-olds use the scheme in exactly the same way, except their card runs out after 4 visits to provide more regular contact between them and the registering practitioner. And finally, each distribution site is required to collect a small amount of information for monitoring purposes. There are guidelines in place for anybody wanting to access condoms who fall outside of the target bracket. For under 13s can be provided with information about relationships, sex and sexual health services as any other young person, and issued with 2 condoms as part of an information session. The practitioner must, however, discuss this with the Department for Children, Young People and Learners, Social Care Services, and guidelines are provided. For sex workers requiring condoms, they should be issued with 10 condoms and signposted to the Croydon GUM clinic for future supplies. For organisations working directly with sex workers, however, bespoke arrangements can be made. Practitioners are required to attend training regularly. In order to become accredited, they must complete the Condoms R Cool training course in their first year. Over the next 2 years, they must complete another sexual health course, and in the 4th year, they must take a Condoms R Cool update training session. And this is just to keep them up to date with the scheme and any new developments. On completion of the Condoms R Cool training course, participants will be able to administer the C-Card scheme according to the policy, have the opportunity to explore their own attitudes and values around sexual health issues, have explored how to promote effective condom use, and be confident in providing information about appropriate condoms to clients. They will feel more confident in working with young people on discussing issues relating to sexual activity, and know about the range of health services available to clients in Croydon, including how to access emergency contraception, ongoing contraception, and sexually transmitted infection services. And finally, they will have an awareness of the legal implications and guidelines that relate to working with young people. Thank you very much.